Our first series welcomes topic experts using the ISPA 8 investments to frame the conversation, showcasing Scotland's whole systems approach through a long-term health condition lens.
Hello and welcome to today's Movement for Health podcast episode. This today is our Movement in Conversation with Dr. Chloë Williamson and Dr. Suzy Scarlett. Our theme for today is active communications and public education. So I have two guests, experts in their various fields relating to this topic. We've got Chloë from the University of Edinburgh in the Physical Activity and Health Research Centre, specialising in physical activity messaging. And we have Dr. Suzy Scarlett, GP in Edinburgh, very involved with the British Society of Lifestyle Medicines, and can also be found on the other side of a microphone as part of the Movement Prescription podcast team. Welcome to you both this morning. Hello, hello. Thank you for joining us. Nice to see you. So our active communications and public education session today, a very important part of the puzzle as we explore Scotland's activity with the 8 investments, and certainly with the launch of the new Physical Activity for Health framework from Scottish Government as well. So very timely to chat to you today. Chloë, I was hoping you could start us off, if you don't mind, around some of the theory and context and landscape around the importance of messaging and the work that's going on with yourself and others in this field.
Sure. Thanks, Emma. Nice to meet you, Suzy. And really happy to be here to chat about messaging. I love chatting about messaging. So this is great. So I started researching physical activity messaging in 2018. And that was when I got funding to do my PhD on it. And at that time, the UK were developing new physical activity guidelines, but there wasn't really any clear sort of consensus on how we should message guidelines, or indeed how we should message any physical activity information. And it seemed like a lot of the time, guidelines just got sort of doubled up as messages, which is not really what they're for. They're really for us, and messages should be different for the public. So that was the main justification for me starting a PhD in this area. And during that time, we developed a working definition of messaging. So when I say messaging, I'm talking about development and delivery of any sort of educational or persuasive piece of information that we give to someone or a group of people, mainly in the public, because that's where my research sits. So I have the public as the end user that has the ultimate aim of improving their physical activity levels. But we know that it's not going to go straight from message to physical activity. And we know there's a number of potential psychological pathways or steps that someone needs to go down before they change their behaviour after seeing a message or hearing a message. So we've done a bit of research in that as well. I think it's a really, really important part of the wider system. And I think I spent a lot of my time with people saying, well, messages don't change behaviour. And I'm like, yeah, but they might change the way people think and feel about physical activity. And then when someone has opportunity in their physical environment to be active, they might be more inclined to do so, kind of thing. So I tell people, you can put in cycle lanes, but if people don't like cycling or think it's dangerous or don't think it's for them, then they're not going to use them. So it's an important part of that wider system, which is reflected in the 8 investments. So we know now it's all the pieces need to come together, and messaging is an important piece of it.
Absolutely. Absolutely. A lovely introduction there, Chloë. Thank you so much. Suzy, from a practical application point of view, in terms of your hat as a general practitioner, what you see with your patients and how you talk to them about being active or encouraging more movement that is meaningful for them, what tools do you deploy? What do you think about? What resources do you have at your fingertips, if you like, to help that individual?
Emma, thanks so much. Really good question. So as a GP,
what we have is we have you asked which tools we have. Well, our main tool, our scalpel, if you like, as general practitioners, is the words that we use. And I noticed that you're very careful with the words that you use. Neither of you have used the word exercise, which, you know, people erroneously throw about and wonder why patients are rolling their eyes. You absolutely cannot start by putting the patient off. You have to meet the patient where they are. So as a GP, I think, you know, you don't have very much time, but what you do have, hopefully, not as much as we used to, but is continuity. So we know that brief interventions work, and you can't just use them once because, like you say, Chloe, you know, you're not going to just suddenly turn someone into an athlete just by suggesting that it might be a good idea to move around a bit more. You know, you've got to introduce these ideas gently and make people feel like it was their idea in the first place. So I think it's about choosing people when they're at the right, you know, choosing the right time to have conversations with people and making it relevant to them. And making it something that they want to do, and I guess that's about understanding the patient in their context. So understanding, using words appropriately, and making things relevant to people. I think that answers your question. I hope so. No, it does. And I wanted to pick up then on timing. So that was something that you said there about who did I work with? Professor Annie Anderson taught me the phrase teachable moment. And that window of opportunity, I guess, isn't it, around that? When will be best to influence that person? When do the stars align to make your message the most impactful with that person? Chloë, does that feature in the research around messaging?
The teachable moment part?
Yeah, like that timing.
Yeah. I think if you look at it through the lens of certain psychological theories, maybe, yeah. I suppose it does in the sense that we know now that messages have to be context specific, which Suzy was talking about as well. So they have to be relevant to that person in that moment in time in relation to what else is going on in their life and the opportunities that they have and what's important to them. And that's why we're working hard with the physical activity messaging framework to make sure people include members of the target audience in the research, because otherwise it's really hard to know what is important to them. In the best situation, you have the one-to-one individually tailored messages, which Suzy sounds like she's doing an amazing job of, where you know a little bit about that person. So you can actually, like you say, meet them where they are and tap into what's important to them. But the challenge comes when you're trying to message or deliver communications to a wider group through, for example, a campaign. Even when they're targeted to a specific population subgroup, it's really hard to get the context right for everybody. In fact, it's impossible. So it's that balance between trying to figure out what works at the larger scale, what's the best we can do in terms of these widespread targeted messages, and then finding those opportunities like interaction with healthcare providers where there is opportunity for that one-to-one tailored advice, which is what could really help someone think differently about physical activity and think about how they can include it.
Yeah.
So, yeah, I suppose it depends on who the population is. Like, we're working a lot. We're doing a bit of research just now with Faculty of Sport and Exercise Medicine and Nuffield Health, and looking at symptom-specific messages for people with long-term health conditions. And a lot of them have brought up, you know, if individual who's had a stroke, that's been a moment where everything's changed for them. So you either exercise becomes really scary and something that they never want to do, or it becomes a pathway to enjoyment and better health and, you know, an improved quality of life. So I think in certain populations that teachable moment is even more important. And in the general population, it's just the social norms, isn't it? Like, is cycling to work the normal thing to do? I don't think in Scotland at the minute it is, but yeah, just sort of changing the way people at mass think about it, I think, is really important. And then those teachable moments in certain populations and individuals, based on their context.
Yeah, I think that tailoring of message on that individual level is so critical.
Yeah.
What I struggle with, I guess, with our work at Movement for Health, so I'm so glad you brought up, obviously, people living with long-term health conditions, which is what our work is focusing on. How is what they can do celebrated, respected, encouraged without being, but can we do more? And that's great. And now we'd like you to do X, Y, and Z as well as. And I think I don't think anyone's got the messaging quite right yet out there. And with long-term health conditions, they're so unique to the individual and how that individual experiences them. Was at a conference recently looking at diabetes messaging around physical activity and how the timing of that physical activity for people with type 2 diabetes quite crucial in their day to help them manage glucose, insulin levels, and all sorts of symptoms. And I really took a crash course in that sort of diabetes world for that symposium, which was so interesting, but not something we've thought about in our messaging, is that trying to be as inclusive as possible for as wide an audience as possible leaves you with messages which are still really relevant, but perhaps can't be as effective for those individuals thinking about risk versus reward. Maybe it's something that's quite a very new diagnosis and that they're still in a phase of learning and coming to terms with, and what does life look like now? And perhaps that's more that, where does that teachable moment come in? Where can you appreciate that person's struggle? So perhaps that's not the most relevant thing to talk to them about in that moment and come back to it at a later stage. I wondered about how we use other professionals in this landscape. And I know, Suzy, I've spoken with a wonderful person that you work with at the surgery who is your community link worker, social prescriber, and their role within this work, specifically, I think, with patients as well, living with those longer term conditions and those sort of that lifestyle management things. I wonder if you could explain a little bit about how that relationship works, what that looks like, and what the massive benefits having that role in practice you've seen.
So it's focusing on our fabulous link worker, and we've had a series of them over the years, but a GP maybe has 10, 15 minutes with a patient, and yes, you can have that 10 or 15 minutes on a intermittent basis. But we know that, for example, people particularly with mental health issues that stand to benefit a lot, and people who have mental health issues and coexisting physical health issues, we know the bidirectional relationship between depression and diabetes. Diabetes is one of the big things that I care about. I do the regional lead role for that. And we know that people, we really want to encourage them, but we can't hold their hand. Now, the link worker can begin to hold their hand. They link the patient in with what is relevant for them. They have time. Time is really their tool. We don't have as much of it. We try to use it as best we can. But the link worker is able to then take on their caseload and, whether it's a phone call with them, whether they get them into the practice or whether they then go out and actually visit the patient either at home or take them and get them across the threshold at a place that's relevant for them, whether that's a local walking group, whether that's a local seated exercise group, which I think is absolutely brilliant for some people as well. Whether it's linking them into local sort of programs, Fit for Health, or there are local programs that we can link them into, but as a GP, I can't take them there. I can't hold their hand and get them across the threshold. And as we know with many things, the hardest part with any of these things is just getting started.
Yeah.
So that is where the link worker comes in. They are absolutely invaluable, particularly in an area like where I work, which is very deprived. People just don't have necessarily the agency, the financial wherewithal, the time, and frankly, the confidence as well.
Mm-hmm.
A lot of people that I work with will think, well, that's not a place for folk like me. So, the link worker will spend that time with them, help them with that level of confidence, mm-hmm. and find something that's relevant and suitable for that patient. We would be lost without our link worker, and I know there's funding issues at the moment, and it's making me very nervous. But the link worker is brilliant, and we're very lucky to have her. And I'm just trying to think through all the various people that she's helped. I think about some of the patients that I work with in the substance misuse clinic, who have got onto swimming programs, and when they've been part of that, they have been so well. Unfortunately, as with life, there are peaks and troughs, and people might engage with the program and then maybe not stick with it, but there's an opportunity then at the next teachable moment to say, well, I remember how well you were and what was going on. How can we get back to that? How can we help you get back to that phase? And, again, maybe the link worker works with them again. Just depends. I don't know if that answers.
It does. I really enjoyed the story that your link worker gave to us for our conference earlier on in the year, and the obvious joy that they get from their job as well, and having those incredibly personal connections and being able to really see someone thrive in a really vulnerable time in their lives is so powerful. And the power of those stories as well, when we're talking about communication and public education, the theme of today, something that organisations such as ours do, I think, really well, is help people to tell their story to a wider audience in the hope that that rings true and resonates for others, and inspires them to maybe have those conversations and changes with their GP or whatever support that they have out there. So when I think that's maybe something we could consider when we're looking at these large scale campaigns, is making sure that the real voices are included. We can have these blanket messages, if you like, that we're all used to, but how to make that really personal and bring it literally to life, I think, is to bring those stories to the fore. Chloë, is that something in the research? Have I just discovered something?
You have very interestingly triangulated some of our headline findings from the study we're doing with FSEM and Nuffield. So we've done 5 focus groups so far, and I think we still have another 1 or 2 to do, because there's some long-term conditions and symptoms that we haven't had as many participants in yet. So we still want to get some more data. But so far what we're finding is it's similar to the other research we've done. Physical activity messages should generally be positive, should highlight the short-term benefits. Usually these relate to mental and social health, not long-term physical health, even in populations who have long-term health conditions. But specific to this group, we found that messages should really try and acknowledge the condition and the symptom and the barrier. So don't try and sort of brush over it, but that's and be empathetic in that sense that we know that this is hard and this might be a bit painful. Your pain might increase, your symptoms might worsen in the short term, but these are the benefits that you're going to get from it, kind of thing. And then really importantly with this group came through a lot around that testimonial type message. They don't care about hearing from people who aren't suffering in a similar way and aren't experiencing similar symptoms. They want to hear from real people and see themselves in messages. So even when it's not testimonial messages, the models and images that are used need to be relatable and representative of the group you're trying to target, especially for this group. So they talked a lot about if they saw someone that looked a bit more like them or just said, I have this condition and these are my symptoms, they can immediately say, yeah, me too, even if they don't necessarily look like them or they're a different age or a different gender, whatever it is. So that came up a lot, and that's been quite unique to the research we've done with this group. I think across, because we did some research with postpartum as well, and they were similar in that they were like, I want to see pictures of mums covered in milk, vomit, like whatever it is, disheveled,
looking our best.
Yeah, I want to see these, really well presented, perfect matching gym set. Like that's not relevant to me, and it's not what I'm trying to achieve just now. I just want a bit of fresh air. I just want to blather with some other new mums, and get some steps in and improve my mood a bit, kind of thing. So I think just trying to tap into what's relevant to them and what's relatable to them. But that testimonial thing that you were just mentioning has actually come up as a clear finding in that research that we're doing just now. So well done, Emma.
Thank you. I'll take that.
Yeah.
I really like that idea of, well, not like the idea, but I'm a mother and thinking back to those quite dark days sometimes after, with newborns, and I remember seeing images on, damaging things like social media and things that portray this. You should be able to cope. You should be able to wash your hair and present yourself in a certain way. You should be able to just go to the shops with babies straight away. There's a lot, I think, of postpartum and at lots of different times of people's lives that the reality just isn't being presented out there in what people are seeing. And I've said social media, and there's another line I had as a question around social media. And I wondered about social media campaigns, and what we're seeing is a lot of organizations using influencers to get their message out to different audiences, etc. And I just wondered how successful you think, or if I'm not sure if the evidence is there yet with social media campaigns itself in a health context. I've seen a lot of campaigns, but it's more like selling a product rather than sort of a behavior change type of environment. But again, I was at a conference with a environmental influencer, Public Health Scotland, earlier this year, which was fantastic. They were such a breath of fresh air in that room, and they had talked about doing searches on TikTok for health research and things, and a paper that they had done, an important paper, put it on their TikTok. It got like 2,000 looks in however many minutes. I don't know what the metrics is. But then they put out a different message using the thinking around the paper that they'd written, but they messaged it very differently, more snazzy, more campaigny on social media, and it got millions of views in however many minutes. So what are we missing here? Or how is this the new world? Is this something that we should absolutely be really paying attention to and thinking about as organizations for our own campaigns, etc.? Thoughts from either of you on social media and health messages?
Do you want to go, Suzy, or do you want me to go? Okay. Yeah, so I think we can't ignore the power of social media, and influencers are very influential, hence their name, especially for certain groups. So I hope he won't mind me talking about this, but we had Professor Adrian Bowman visiting in October, and I was asking him, because one of my big challenges is evaluating messages, and it must be even more so on social media. Like, you make these messages and send them out, and it's really hard to determine if they worked or not because of the nature of messages. They just sort of go out, and you can't keep track of who's seen it and who's not, and that sort of thing. So I was asking about that, and he was telling me that they've just wrapped up a big, and he's supposed to be retired. He's one of them, like,
I know. He was at the conference last week. I was at as well.
Or semi-retired. The next, they just keep dabbling in things. Some big study in Australia, and a different health behaviour. So this study was about sun dangers and skin protection. Really, really interesting. So they took a bunch of money and they paid all these influencers to deliver messages in the way that they wanted. I think they gave them a brief, a sort of remit around, these are the main things we want you to communicate, but then you have free will to communicate how you want with your audience. And they did some pre and post measures with different people in the population that they were trying to target. They had segmented that population into, like, you had like the sun worshippers, and then you had people who spent a lot of time in the sun, but just because they didn't really care or didn't know, like, seriously, like, there was a group of sort of young men, for example, who didn't wear sun protection, but it wasn't because they wanted a tan, they just didn't give a hoot. And then so all these, and then people who were aware and kind of still wanted to sunbathe but wore sun cream and that sort of thing. So they had all these different groups, and I think they might have been following a couple of them as a sort of cohort in this study as well. But yeah, I think from what he said, like, it sounds like it worked, but the main challenge with the social media stuff and any mass reach campaign is effective evaluation, like I say. So the best you can really get is the reach and the awareness. How many people saw it? How many people are aware of it? And then it's really hard to follow up with behaviour change, apart from if you can get a subsample and do a pre and post, which I think they did. But getting the funding to do that kind of study, and then getting the funding to pay influencers. Influencers are so expensive. And I mean, kind of rightly so, because they do have a big influence, but yeah, you'd need a big bit of funding to do it properly, I think. And I think there's maybe things that can be done with influencers who have an inherent desire to help people improve their physical activity. And a lot of influencers do gym stuff and physical activity stuff. So it might be that we should be open to collaborating with people like that and seeing if we can use them as delivery mechanisms for messages.
Again, it comes back to who your end.
Exactly.
What's the goal? Who's at the end of these messages that you're trying to? So are they on social media? And maybe
so who do they follow?
And then I was thinking as well from a more prevention angle, potentially, rather than, as it appears to be, obviously younger generations that are more online and perhaps engaging more with this content. The messages should be more around prevention, but perhaps that doesn't matter to them yet. I was indestructible when I was a teen. Certainly, but
we shouldn't talk to them about prevention. We should just make physical activity seem really cool.
Seem really cool.
In
the norm.
Exactly. And I think some gym influencers, that is the kind of message they give. This, you should be doing this because this is what people our age do. We look after ourselves.
Again, it needs to look like all body types and all shapes and all sizes 100%. And all ethnicities and backgrounds and everything else. And I think that there's such a danger as well with that over promotion of different body styles that people should supposedly have an ambition to have. Suzy, I wonder in the real world what that looks like in your eyes.
It's so difficult to know which angle to take on this. I've got so many thoughts I want to share with you. The first one I just want to share with you is actually a bit with my mum hat on. I have a young daughter, and thinking about social media and girls in particular. And we'd said, oh, let's do a yoga video. Let's go and do that. So I let her select which one. And she chose this girl who was showing us how she managed to do the splits in 2 weeks. And I just thought, oh my God, this is everything that is wrong with social media and YouTube. This girl clearly has a connective tissue disorder. That is not normal, darling. Please do not watch this and think that that is what you should be able to do. That is setting yourself up for failure. So that was a very real world example that I had here in my house on my watch. And this is what I worry about with all of my patients that come in with anxiety, with increase in self-harm, suicidal tendencies, all the distress that they present in lots of different ways these days. One of my other hats, I've recently taken on the British Society of Lifestyle Medicine regional lead role, and was invited to speak at a school actually about mobile phone use and social media and the effect on the pillars. And obviously, physical activity is my favourite pillar. I'm not supposed to have favourites, but I do. And it was really interesting talking to young people about the effect that mobile phone use has on. And I was trying to have a really balanced view about the use of phones. And these kids were at a state school. They didn't have access to other social media. And I said, what is your screen time? One of the kids said 16 hours. And I said, what is the opportunity cost of that 16 hours? That's a very sedentary behaviour. Some of them were saying, well, you could use it for Strava if that's what you do. You can use it for good. And I said, yeah, do you know what? I use it for Strava, and that is really helpful, and, keeps a record of what's going on. But what I was really pleased was at the end, somebody raised their hand and they said, are you trying to tell me I should spend less time on my phone and more time doing physical activity? I was like, well, I'm going to let you reflect on that. And I'm so glad that that was the message that he took from our discussion. But 16 hours is ridiculous, isn't it? At the other end of the spectrum, I'm thinking, how relevant is social media to a lot of the people that I treat with long-term conditions? Yes, there is a cohort of the population that are these silver surfers, but I still work with lots of people who don't have access to a mobile phone. They're not going to get that messaging. However, what I did see the other day, which I thought was incredible, have you seen the Canadian government and their recent campaign? And they've got two sides of the screen, and one is with exercise and one is without. And they've got these two parallel men must be in their 70s. And it is just the most powerful video. And I thought, do you know what? That is brilliant, because they've got in not only the older men, they've got in all these aspects of their life. They're making it relevant. They've shown the daughters, the grandchildren. So they've brought in all the stages of life to this very clever video. I don't know if you've seen it. I don't know what the research is on it, but I thought that was really powerful. I want to put it in my waiting room. I don't know how we can do that. But Chloë, have you seen that video?
Yes, and I was excited to see it because that's another thing that came up in our study with the Nuffield group. So I don't know what what that video was based on. I'm assuming they did probably similar, some sort of. I hope they would need some research based on. If not, they've accidentally hit the nail on the head, which is great. And yeah, a couple of the people in the focus groups we did, they said, yeah, we want the positive messages, but I also do want a little bit of, I need to see this is what's going to happen if you're physically active, and this is what's going to happen if you're not, and the two potential ways my next few days, weeks, months, years could go. And there's something about that in terms of, especially in clinical populations and people with long-term health conditions, and in older adults, we've seen it a bit as well. It's not so much just about, so in general population, Emma, we've spoken a lot about how you should promote mental health, social health, feel better, improve your mood, the immediate benefits. But in some populations, those sort of, developing other non-communicable disease, not being able to be independent and live by yourself, those actually don't feel as far away or as unrealistic as they do to other people. And so in some populations, those outcomes are actually really important to message and can really give people a bit of motivation and change the way they think about physical activity. But I think having a bit of both sometimes could work really well. So yeah, I agree. I think it was a good shout.
I was just going to say the only thing I would say about that is they use the word exercise, and as we said at the beginning, the nuances of language I think are so important, and I wish they'd put physical activity or movement or something. I don't know.
It's really relevant because I was thinking about an advert I haven't seen for a while. I don't know, probably I don't prescribe to channels with adverts so much anymore, but it was an older gentleman wanting to lift his granddaughter, and he used a kettlebell, and you saw that progress to him being able to lift and swing and stuff. And I had a little tear in my eye the first time I watched it because it's emotive, I just really liked it. Seeing the relationship my kids have with their grandparents, and certainly when they were babies and toddlers and little ones, and what he carried everywhere, and active play and things being so important. And the ages of being a grandparent have changed a bit over the years as well, and sometimes people are much older now when they become grandparents, and I think that keeping active for as long as you can has so many ramifications. I wanted to touch on the environment of these communications as well, in terms of where they're happening. So far I've been thinking about our conversation as in like written words or people talking at a screen or something. But I'm wondering about those subtle messages within, say, a doctor's surgery. And Callum Leith was on chatting to me on another episode of this podcast about active places and spaces. And we were talking about, maybe we'd have a yoga mat in the corner and some sort of props almost that kind of look a bit like, that this is an active space. And he was saying that he always likes having his bike helmet on his desk so that it's a prompt, if you like, so I think there's a lot of things going on there. I was thinking about like nudge theory, which I used to use a lot in screening programs when I was involved in screening programs, around sort of family members nudging for that particular exercise. It was males within the family to do their screening. And then I was thinking about that leading by example message. And I did wonder about, and maybe this is a bit sensitive actually, so you can correct me if it doesn't feel right, but sometimes I think very fit and able and obviously athletic people telling or communicating to people to move more could be a bit tricky for some people. So there's a few things there in terms of the environment and how you could present an environment in a way, but also about who is giving the messages. I suppose it goes back to someone like me needs to give me that message. But I wonder, Suzy, in a professional environment, I remember going to a hospital once and there was loads of staff smoking outside. And I remember I was on a work thing, and this was quite a long time ago as well. And I just remember thinking, oh, that doesn't feel right at that point. And then I'm wondering about the flip side of that with my example about a super fit. I know that on your podcast there is Hussein, who is just so aspirational in terms of what he does with his own physical fitness as well. But I was wondering, within your circle, within your profession, do you think that makes a difference?
So it's really interesting, isn't it? And I think you're right. You know, somebody once said to me, and it was slightly in a different context, but they said, yeah, it's all right for you skinny folk. You know, because I enjoy movement, and that's what I love to do. But I in my own environment, what I have, as you'll know, is that I've decided to subtly have the message there. Yes, my trainers are usually underneath my desk, but I also have my standing desk, and it's always up. Now I sit and I face my patient and I engage with them, but then I demonstrate. And people are often inquisitive. Why are you standing up? I say, I hope you don't mind, but I've got some back pain and I've made this change. And so I demonstrate it in a sort of a soft and subtle way. The other thing that I've done is in my own consulting room and in the waiting room, we have lovely, beautiful photos of green and blue spaces that are within the practice boundary, because I want people to remember that, yes, we live in, you know, a very urban, deprived area, but there are beautiful green spaces within a stone's throw. And the other thing that I've got up is maps and showing accessibility. They are urban exploring maps, and I've got one in my room and one in the waiting room. Because a yoga mat's a lovely idea, but nobody would use it. Absolutely nobody would use that. But they might look at a map and think, oh, I didn't realise that was there. Maybe I should go and have a look. You know, I've seen people up looking at the photographs, and, you know, I'll say, oh, you spotted that photograph, have you? Because I love to strike up conversation. And people say, oh, God, I haven't been there for years. I'd forgotten that was there. So I tend to take a slightly more hands-off approach. You know, my goal would be to have some sort of really fun game where people don't realise they're doing movement. So I don't know if you've ever been to the Edinburgh Museum that's got this lovely light thing where there's a grid of like 9 or 12 lights, and one of them lights up and you have to press on it and you get points, and people
like
get
whack-a-mole.
Yes, whack-a-mole. But it is actually quite physically demanding. I don't know if you've ever done it in a competitive frame of mind. It's very tricky. So that would be my absolute goal, would be to have a whack-a-mole on the wall that people could maybe, you know, kids could have a go, adults could have a go. The yoga mat, I think, is one step too far. But, you know, when I am in that environment with Callum and with Hussein, who are incredible athletes, I always feel like I'm the one, you know, that World Health Organization graph, which I mention in every single podcast episode that I've ever been on, because I think it's so powerful, is that I like to represent the guy sitting in the chair. And this graph is all about then people's level of activity and the amount of benefit they get from doing a little bit more. And the guy sitting in the chair doing nothing, if he even just does the tiniest little bit, he is getting the absolute steepest part of that improvement curve. And that's who I like to represent. So, yeah, I think it's about having realistic messaging, isn't it? And making it relevant. But I do make sure that the first and the last thing that people see as they come into and leave my room is a beautiful picture of the sun over the water, because we have that within our practice boundaries. So
I think that's
lovely.
and lovely, lovely examples too. And I think just reflecting on my own general practice, which I live very close to, we were very lucky in that it's quite a new space. So it was purpose built to house several surgeries from the city I live in, but it's also built with a dementia centre and a nursing facility, care home facility, and they've worked with the conservation volunteers and other organisations, dementia friendly perspectives, with Paths for All around what the space needs to be. There's a really lovely nature trail within it. It's very subtle, very, very subtle. It's a bike hub as well. It's, you know, an active travel hub. The bike doctor goes there. And there's also a nice cafe. There's also a nice, you know, it's promoting movement and socialization, and as well as, yes, you come here to see your doctor. But I think I hope that's the way we're going. I remember my first GP surgery was in a tiny sort of Georgian house down really steep steps. I had to get in a very dark, slightly moldy room. It didn't really feel, an environment that was welcoming, or it certainly didn't encourage me to move in any way. I love that visual prompts that you're talking about there, Suzy, around with the maps and that intrigue. And you mentioned children, and I think that it would be lovely to think, and I think there is a lot more thinking around this, about gamification of things is not just for the young, it's for all ages. And if you put whack-a-mole on your wall, I would that would be the first thing I was drawn to when I walked into your surgery as an adult and at any age and stage. Definitely. And really nice examples. Thank you. I'm going to, unless Chloë, you have anything on the research side of things in terms of visual prompts and things, is that something that's covered within your research or anything that you're aware of?
Yeah, I think a lot of what you're referring to is what in the research they call the point of decision prompts. And the most common one is that, where they have something on the stairs to tell you to take the stairs, or something on the, so in a moment where you have a decision to do A or B, it's trying to encourage you to do one or the other. But I think that's it. I love the example Suzy gave, and it's about just encouraging people to make easy decisions in their day-to-day life, like take the stairs or stand up during a meeting. You're not asking them to go for a run or, start cycling to work. I think having the helmet, having the trainers under the desk is good because it's showing that you walked or you ran to work. I'm a really physically active person. I'm a physical active researcher, and when my colleagues come in cycling, I still think, whoa, that's too far for me. I wonder. So, yeah, I think it has to be realistic. And I really do like the stair ones. For people who are able, I think there's still more research to be done about how we get that stair. And I think it's different for different people. We've got them in our work that's like, if you take these stairs every day for, you'll have climbed this many Monroes, and you think, that's quite cool. To say that. But then we put them up on the lifts. I worked with some of the team at the uni to put big sort of vinyls on the lifts. And it's just like, take the stairs, you'll feel less stress, or take the stairs, it's faster. Don't stand around waiting on the lift when you could just zip up the stairs quickly. So I think, depending on what appeals to different people, will be what you put in it. But I love the idea of the green and blue space pictures and just trying to encourage people to get out, because they've got the opportunity to. That's the thing. You're not saying, go and do this thing that's really hard. You're saying, look at this lovely thing that, is near you, and you could do it. You could just replace a bit of your TV time tonight with a nice walk. I think there's a lot to be said about those little decisions in day-to-day life and how they can all add up to change someone's behaviour. It's like a gateway into more organised activity as well.
Yeah, excellent. I've been to your offices, and there's also there was pitch and putt when I was there. There was like a little golf thing going on at Park. Yeah, got a ping pong table.
Jigsaw puzzles along a bit where you have to stand to do them. So when you take a break and you go make a cup of tea, usually you accidentally prolong your cup of tea break by getting engrossed in a jigsaw puzzle.
I love that, and that's movement through in another way as well. So yes, you have to move. It's designed so that you have to physically move these types of puzzles. But something that I was talking to someone who lives with a very severe chronic pain condition, and they were really struggling. But I was trying to help them reframe their thinking around, actually, you're doing lots. Your movement through art, you're moving through your breathing, you're moving through your mind because he was reading a book and we did puzzles together and stuff. And it was just trying to reframe that thinking a bit about what movement means and what meaningful movement is for someone who was living in a really chronic bedridden, stay in bed state at that time. Lovely examples from you both today, and thank you so much. I like to end with just asking a bit of a personal question to the guests about your own movement for health. And I know you're both active people, so you'll have lots of different things to potentially pull from, but what would you say would be your most meaningful movement for health, and how does it help you in your day-to-day? I'm going to pick on Suzy first.
Oh, my most meaningful movement. Well, the one I do most of the time is I run from A to B. I've made a lifestyle of being late and put on trainers and wear leggings a lot of the time so I can run from A to B. But actually, the most meaningful movement for me is what I did this morning. It's my non-negotiable Friday morning. I go for a run. I don't usually like running with people, but I have a friend that we run and we put the world to rights, and then we do what I call the Faf Light Swim. And the Faf Light Swim is probably the most meaningful part of my week because it's the time that I slow down and stop, which is interesting when it's movement, but it is the time that I actually, it recombobulates me after the frenzy of a normal week, a week in the life of me. It's the one that is my migraine prophylaxis. It's hard. So you always come out, it's hard getting into the sea in Scotland, but it is wonderful coming out. And so I think that's probably my most meaningful. It's free, it's accessible, and it's brief. So tick in the box for everything for me. That's my favourite. Chloe, what's yours?
I have two that I can choose between, Emma, so I'm hoping you'll let me have them both, and they're very different. So my non-negotiable is walking my very high energy rescue dog every morning, and because she hates people, cars, dogs, everything that moves or makes a noise, we walk very early and there's no one else around. I live in a nice little village. We can hear the sea, and it's as much as that you're knackered when the alarm goes off. I would never trade that sort of peaceful way that we start the day, and it's just so nice to get some fresh air, get the steps in, and yeah, you spend time with your dog too, which is lovely. And then the other is where I put on big headphones and listen to sort of heavy rock music and lift really heavy weights. And I love lifting weights because you can see your strength you just feel yourself getting stronger every week, every month. And I really find it such a good stress relief. Like, it doesn't really matter what's going on in my life. If I can go and lift some heavy things a few times and pick them up and put them back down again, I will 100% feel better. And you just feel so accomplished and sore in that sort of good way. So yeah, dog walking and lifting weights are my two favourites.
Excellent. Excellent. Lovely, lovely inspiration examples there. I concur with the dog walk. I concur with the cold water swim. I don't concur with running, and you'll never persuade me otherwise. And that's fine. Thank you both so much for joining us today. And thank you for listening to today's podcast on Scotland's active communications and public education. Hopefully you've enjoyed it. And if you have, please listen to the other episodes in this series. That's it for now. Goodbye until next time.